Dr. Sibongiseni Dhlomo, the Deputy Health Minister. Denang, thank you so much for your time this evening. Take us through the thinking behind this, and in simple terms, what does it mean for those who will be using the services?
Thank you very much. Thanks for this opportunity. We would like to take a benefit and give the South African young people the benefit of doubt that indeed they are complaining with something that we need to take up to say, but Dr. Dhlomo, we don't find a very friendly services in your clinics, especially for us young people. We go there and seek help that is mainly focusing on our reproductive health, and we don't get to be assisted. There's judgment there. We are asked why this and that. So we had then started a program called Adolescent and Youth Friendly Services countrywide. So today we were in Willowvale Community Health Center in Kachana under Mbashe Municipality with an MEC launching this program, which was a very successful campaign, saying to the young people, there is a nurse trained there to look after your interest. It's a youth-friendly service. We would want to say to South African young people, this is your time. This is the struggle that you now fought for, your elders fought for. We need to give you the service that is worth your while. Go to this clinic. Don't have any chance of not finishing your matric with pregnancy. Finish your matric without any pregnancy. Finish your matric without HIV infections. And this is a space, this is an opportunity we give to you. Come for the advice. We would like to assist you in that regard.
And quite critical, because that is a province where we saw some, worrying HIV new infections and also even some of the teenage pregnancy stats. Are you also training some of those that will be working with them to ensure that they are at their level and not passing judgment, as you've alluded to earlier on?
Yes, we do have in the country 1,200 health facilities already where at least there's one nurse who is trained on this, what we call youth zone activities, where they are friendly to young people coming to their facilities. So we don't launch until we have actually had that. So we want to accelerate this process so all clinics, all community health services in the country would at least have a nurse who will mentor and support other nurses who's well trained on what we call adolescent youth-friendly services. So this part, we were in Willowvale CAC with the MEC launching that. There has been a successful program in that area, and therefore encouraging all youngsters everywhere to say, go to a facility and say, do you or do you not have youth-friendly services here? If they say we do, then they must ask for the appropriate nurse who is trained to assist them in those processes.
It's one thing for them to approach you, it's another for the need to be quite a lot. How dire would you say is the need for these services in the province where you've launched them today, the Eastern Cape?
No, we just happened to launch them in the Eastern Cape because we are closer to where there is going to be a presidential event of the young people of the Youth Day tomorrow at Umtata. We were doing this also in KwaZulu-Natal. We went to Northwest, so everywhere we go. But I was glad because of these 1,200 health facilities in the country that has got already a youth-friendly services. 402 of those are in this province. So we would want them to accelerate and do more. It is actually needed. Young people must find that we are giving them this. It is their right to come to our facilities and get an appropriate services. Look, a young person at the age of 20 will still look for about 45 years from that person to leave. Now, we would want them to really make sure a long and healthy life starts with them looking after themselves. And we are here to give them support in terms of what do they need to really live a long and healthy life from the health side. That is what we're actually providing for them.
And while this, of course, goes a long way towards addressing some of the issues that young people are facing, the Eastern Cape has been one that we've seen over the years with lots of issues when it comes to healthcare. I wonder how far then do you also go to addressing some of the critical, challenges that residents are facing? For example, ambulance response time in some of the areas, while in others residents say, healthcare services are simply too far and they cannot even get there with taxis being so expensive. What is being done also to address some of these other challenges?
Just before I came to meet with you, Mazwane, we went past Butterworth, an area where a mayor of the area had actually indicated to me there are challenges there with regards to the forensic pathology services. So we went there with the MEC to look into that. Our benchmark, Mazwane, is to look into what we call a presidential health compact. There's a document that guides us. We might find ourselves deviating from it, but we need to benchmark ourselves to how far, when are we going to have enough ambulances? When are we going to have enough staff members for this and that facility? Where are we in terms of revitalizing our infrastructure, in expansion of the clinics and all that? So we already have a document which gives us a checklist and be able to see. And there's another program called Office of the Health Standard Compliance. If you want to go to the National Health Insurance, you have to actually accredit facilities. But before you accredit, there must be the particular level of acceptability of being an ideal clinic, an ideal hospital. So all that we already have, and it probably may be due to shortages of funds that we may not be able to reach all that at the time we want to. But we do have a guiding document that tells us what must be done in terms of really making sure we come to an ideal, optimal health services for the country.
And that is also going to be important because, I mean, when you look at a document, for example, like the NDP, it talks about, envisioning a health system that works for everyone and produces health outcomes and is accessible for all. So it's going to be critical that there's an accelerated approach towards achieving this goal.
Yes, it is very important, even if leaders will come and go. But if we fundamentally say to the DG, to the provincial heads of department, this is the plan, this is the 2030 plan of this government, follow it and see how far are you in terms of making those achievements. We owe it to our people. If we want to promise them a better quality of service, then we must be seen to be really doing that. But not only in the Eastern Cape, generally the challenges of infrastructure, challenges of staffing are all over the country. We are working on that steadily. Of course, we do need the support also of the Treasury in terms of improving on those facilities. But we would want to give our people that already we have a guide, we have a plan. It may just be shortages of resources that will make us not to reach there at the time that we want to be there by 2030 or so.
Dinangwe, if you may allow me, please indulge us on this one as a final question as we chat tonight. I can't help but ask you this. Last week we saw a very worrying situation emerging from Rahim Musa Mother and Child Hospital, where even a doctor had to be so desperate to write an open letter talking about toilets that aren't working, children that, he says are dying, especially when there's load shedding because generators can't hold. We subsequently spoke to a doctor who says that the need is so dire there, and not only in that hospital but in Gauteng hospitals, and they really are battling. I wonder if you may have seen some of those headlines, and what were your thoughts when you saw those stories?
Yeah, firstly, Mazwane, we are glad that we were able to go inside to say, but this doctor is actually pointing out of some of the things that are challenging them. This is the doctor who wants to give the best of his care in terms of the training that he has. He's short of this, that, and the other. By ventilating that into the public space, probably he has done it many times to those who actually matter in the facility, who are supposed to run that facility. Our minister is out of the country for a week. We have really planned to go into that matter. But what we did quickly was to say, please reverse this decision that has been taken by this hospital for that doctor, because this doctor is not lying. This doctor is actually, trained as a clinical and a clinician. There are certain specific things. You want to see help patients. You can't have patients dying in front of you because you just don't have the basics to assist them. So that is what we are going to do, Mazwane, including the challenges that we are talking about in Gauteng province. There's been challenges in Child Makheke. We also face other challenges at Chris Baragwanath Hospital. Now Rahim Musa also has his own. So there is a plan to say, Minister, how do we assist not just that province, the service delivery at a basic care of entry of our patients. Patients should not be getting what we are actually exposing them to in some other areas. It's simple management to deal with those issues that really should assist us moving forward.
Dinangwe, and I hope that when that plan comes into motion, you'll come back on the show and we'll talk more about the services that are being delivered to the public. But let me thank you for your time this evening. Do appreciate it. That was Dr. Sibongiseni Dhlomo, Deputy Health Minister.